Hello, I am Dr. Andre Zbuchea from Romania, and I have the pleasure to present you honey as a biologic dressing for healing, data supporting its use and clinical experience. Introduction. Honey is one of the most complex and valuable natural biological products which have been used since ancient times, both in nutrition and medicine. The therapeutic properties of honey have been scientifically highlighted by numerous in vitro studies, laboratory experiments, and clinical trials. The anti-infectious activity of honey, a traditional remedy for the treatment of infected wounds, has been confirmed through laboratory research. Honey has a broad-spectrum anti-infectious action against at least 80 species of microorganisms, including types of bacteria multi-resistant to antibiotics, such as Pseudomonas, Acinetobacter, methicillin-resistant and coagulase-negative Staphylococcus aureus. There was no loss of bacterial sensibility to honey over time, and no appearance of bacteria-resistant mutants. In many cases, honey acted where other antibacterial therapies failed, possibly because honey is effective on aggregated bacteria in biofilms, a situation where antibiotics and seaweed dressings proved ineffective. The anti-infectious mechanisms. The osmotic effect of high glucidin concentrations, also an agent that was well inhibited before its identification as hydrogen peroxide, a well-known antimicrobial agent that is produced by the enzyme glucose oxidase in honey, which might also accelerate the healing process. Additional non-peroxide antibacterial factors are methylglyoxal in Manuka honey from New Zealand, bidefensin-1, and melanoidins. The anti-inflammatory actions by assessment of local wound evolution, by biochemical tests of indicators of inflammation, and by histopathology exams. Possible mechanisms are inhibition of complement, inhibition of nitric oxide production by macrophages, inactivation and suppression of lactic oxygen species by phagocytes, the decrease of thermal injury induced oxidative stress by controlling free radicals that are formed in the burn wound, and also an anti-inflammatory factor identified as apalbumin-1, a protein secreted by bees. Antioxidant action by controlling free radicals and reactive oxygen species. Moist local environment is another very important factor due to its high viscosity and to the drawing of fluids by osmosis. It promotes wound healing because wounds heal faster when kept moist as opposed to when they are left to dry and form a scab. It ensures the growth of epithelial cells, the contraction of fibroblasts to approach the wound edges, as well as non-adherence of dressings to the wound, leading to easy and painless dressing changes without the risk of breaking the newly formed epithelium. It allows the protein digesting enzymes in the wound tissues to work and loosen any scab and then tissue. The debriding action is also very important. Honey activates plasminogen and increases plasmin enzyme activity, which lyses fibrin attaching slough by suppression of the macrophage plasminogen activation inhibitor. The plasmin digests fibrin, which attaches debris on the surface, but does not digest collagen extracellular matrix, which is necessary for tissue repair. The nutritional actions indirectly through the osmotic flow of lymph, which brings nutrients needed for healing, but also directly through an intake of easily metabolized carbohydrates, amino acids, vitamins, and minerals. Honey provides glucose support for epithelial cells, leukocytes, and for the process of glycolysis. The epithelial cells require a reserve of carbohydrates for energy migration of the wound surface to restore the epithelial sheath. The osmotic flow. The high osmolarity of honey causes interstitial fluid drainage, thus providing nutritional support for tissue regeneration. It contributes to lifting and removing waste and debris from the wound. It contributes to the lack of adherence of the dressing to the wound. The acidity of honey is usually less than 4. It may contribute to the antibacterial action of macrophages, since an acidic pH inside the vacuole is involved in destroying the ingested bacteria. Experimentation on animals enable analysis of the action of honey inside the wounds produced by dermal burns or by skin excision. It allowed better comparison of results and histopathological examination of wounds, as well as the usual measurements of decreasing wound size and the healing time. It allows objectivity of results by eliminating the placebo effect, which would occur in clinical trials. It has shown the effectiveness of topical administration of honey in wound healing and suggested the importance of using only floral honeys, properly processed, and the synergistic effect of concomitant oral intake of honey. Clinical studies compared honey with different products such as silbesublaviazine, betadine, saline compresses, paraffin, and hydrogel. Is effective in cleaning infected wounds. Gangrenous and necrotic tissues were debrided easily and were replaced quickly with granulation tissue and progressive epithelialization, and also deodorizes very smelly wounds. Honey promotes wound epithelialization and accelerates healing with minimal scalp formation. It improves wound nutrition, blood circulation, and lymph flow, reduces inflammation, edema, and exudate, is calming and soothing. It will not cause any local pain on dressing or cause only a momentary stinging sensation, doesn't cause irritation or allergic reactions, and has no harmful effects on tissues. Acceptability. There is high patient acceptability to honey therapy due to the favorable effects observed in practice, decreased pain, reduced wound size, and the deodorizing effect. Any reservations or even opposition to the use of honey in wound treatment due to lack of standardization and the sticky and fluid nature are now overcome by the manufacture and marketing of honey-based products. Such products have been licensed and approved for topical treatment of wounds, and they have been available in Australia since 1999, in Europe since 2004, and in North America since 2007. There are currently several trademarks and a wide range of sterilized products containing honey registered as medical devices and commercially available. As discussions, in order to be considered in the treatment of wounds and to exert without risks the whole range of favorable effects, honey must be organic, harvested, and processed properly and sufficiently free of microorganisms. Such strict microbiological criteria have been proposed for bacteria at a maximal limit of 10 colony-forming units per gram of honey, and for fungi and a maximal limit of 10 colony-forming units per gram of honey. Honey suitable for medical application has to satisfy certain requirements, being characterized as medical-grade honey. It's necessary to fulfill the following criteria: is organic and free of contaminants and toxic substances, is sterilized, especially through gamma irradiation, under standardized conditions, and free of harmful microorganisms, can be safely used in medical therapies, follow strict production and storage standards and legal and safety regulations, and complies to the physicochemical criteria that are important for the use of honey as a home care product. Let's see some clinical application of medical grade honey for the treatment of burns and other types of wounds in a lot of patients from District Emergency Hospital of Ploiesti, Romania. Case study number 1, man, 59 years old, with flame burn of the right hand, 2nd degree. You can see the aspect 8 days after burn injury before application of L-mesitran, honey-based product. Wound epithelialization after only 3 days. Lateral aspect. Case study number 2, man, 36 years old with scald burn injury, 2nd, 3rd degree on both ankles and feet. Feet and ankles after initial burn wound debridement and before application of L-mesitran. 5 days after application of honey-based product. 9 days burn scar removal. 12 days marginal epithelialization. 14 days progressive epithelialization. 19 days almost complete epithelialization. 26 days quasi-integral epithelialization. Case study number 3, man, 53 years old with scald burn injury, 2nd, 3rd degree on left leg. You can see the aspect after burn wound debridement and before application of ointment. After 4 days, after 9 days, progressive epithelialization. After 16 days, almost complete epithelialization. And the final result at 30 days. Case study number 4, man, 32 years old, with scald burn injury, 2nd, 3rd degree, approximately 10% total burn surface area on left superior limb and left hemithorax. You can see left arm and left hemithorax after burn wound debridement and before application of honey-based product. After 4 days, after 10 days, progressive epithelialization. After 11 days, after 16 days, almost complete epithelialization. Case study number 5, man, 62 years old, with right bimalleolar fracture, open reduction and fixation by the orthopedic surgeon. You can see intermalleolar wound dehiscence 1 week after the orthopedic operation and before application of product. Frontal aspect. 7 days after the application of product. You can see wound dehiscence reduction by marginal epithelialization and remission of ankle inflammation. As conclusions, scientific research and clinical studies for burns and other types of wounds have highlighted a broad range of activities provided by honey, such as anti-infectious, anti-inflammatory, anti-exudative, antioxidant, wound healing, wound debriding, and nutritional properties. Applying medical-grade honey can provide a definite favorable action on healing of burns and other wounds, especially when they are infected, sometimes in conjunction with surgery. The anti-infectious activity of honey without the development of microbial resistance is particularly useful in the present times of bacterial multi-resistance to antibiotics. But more detailed controlled trials are required to establish the best indications and modalities of medical-grade honey application in bites and wound treatment. Thank you very much for your attention.